Hi, everyone. This is Dr. Villanueva, Chief Health Coach of Modern Holistic Health, here with TribeTalk today. And we are super excited because I have an old mentor of mine, Dr. J Dunn, who first introduced me into the world of epigenetics. And I'm just so thrilled to have her on today. Dr. Dunn, thank you so much for being here with us.
Oh, my privilege. Thank you so much for inviting me.
And we've got a lot to get to today. Dr. Dunn, again, thank you for being here. Let me tell you all a little bit about Dr. Dunn. She's been practicing natural medicine for over 30 years. She's a chiropractic physician and certified in functional medicine, and she's internationally known as a lecturer on genetics and nutrition, teaching physicians around the world on how to use genetic information to get to the underlying cause of disease. Now, her drive to understand true cases and her passion for helping those who are suffering from depression, anxiety, and attention issues have led her to create a program called MyHappyGenes. She's the author of the books Holistic Kinesiology and Perfect Health in Paradise, both available on Amazon. Thank you again for being here, Dr. Dunn. We're really excited to talk to you today and to hear what you have to say.
Thank you, Anne. I appreciate it from both of you.
Thank you. Thank you. So, you know, you've got a background not only in chiropractic medicine, but in kinesiology as well, correct?
Yeah, that was really my first love and my first foray really into natural medicine. I was a sick puppy, and that was the thing that kind of gave me my life back. It's a long story short, but I became a kinesiologist before I was a chiropractor, which is kind of like backwards. So a lot of chiropractors become kinesiologists afterwards, but I fell in love with it. I thought it was the most crazy thing I'd ever seen, that somebody would be pushing on your arm and getting information, but oh my gosh, it worked. And then I started using it and it worked. And so I've been in love with it ever since. I can't imagine living my life without muscle testing or kinesiology.
You know, it really is amazing how your body will tell you everything that you need to know if you understand how to talk to your body. And kinesiology, for those of you listening today, to this episode, this provides a methodology in which you can understand what the body is trying to tell you. And so it's super, super awesome. And I know that just like me, you have a passion for helping people find their emotional balance and live happier, healthier lives. And so you dive into things like neurotransmitter or brain chemistry imbalances with people that are struggling with anxiety and depression. And so, I would love for you to share the story behind the creation of your My HappyGenes book, because I'm guessing that this kind of dives into some of that, maybe.
Yeah, very much so. And it kind of happened because I am always searching for more answers, and I imagine both of you two are as well. I just never rest until I feel like I have all the answers for all the patients. And I know it's an impossible thing, but we're on a mission to figure out the body and how it works. And after practicing for 30 years, I still had some questions in my mind. I had a very successful practice in Albuquerque, New Mexico, and people coming from all over the world to see me, et cetera. Lots of good responses, but there were a subset of people that I never could get anywhere with. And I was one of those people. And, I had a lifelong struggle with depression. Nobody knew it. It was not something I talked about. And it's something that I constantly had to work on and try to get myself out of. And chronic fatigue syndrome that I couldn't get on top of. I mean, I'm a functional medicine practitioner. I know, chiropractic, I do emotional work. I do all the things, all the tools I had in my bag, and I couldn't fix myself. And again, I didn't really talk about it because it was kind of a source of embarrassment, if you will. And then again, some of my patients that consistently, same thing over and over again, they'd come into my practice like, here's a virus again, or here's, whatever it was, it would seem to come back all the time. And there was a third thing that kept me looking, and it was the fact that my father died of lung cancer at 55. He was a big smoker, big drinker, never exercised and never did anything healthy. But that wasn't a mystery really, but the mystery was his best friend did the same exact things that he did and lived another 30 years. He married my mom after my dad died. So that's why I watched this experiment unfold. And, you know, in our lives as practitioners, we go, yeah, genetics. That's the only thing that we can kind of like, you know, say about that. And then, you know, we sort of park it on the side and go, yeah, it's genetics. Well, when the Genome Project was finished, it really gave us an insight into understanding how we could work with our genes. Not that, you know, oh boy, sorry, sucks to be you kind of thing, but that you can actually work with your genes and create epigenetic changes, you know, so that it isn't written in stone just because you have a particular gene that you're going to express a particular symptom or disease process, but you can actually work with your genes. And that's what we've been doing with diet and lifestyle factors. But when I started looking into genetics and getting my genes tested, you know, I initially did it with 23andMe, and we put it through some of these early algorithms, and found one of the genes that I found that was so important to me understanding my brain chemistry was the vitamin D receptor. And, you know, in our practices, and maybe you've seen this, where my vitamin D levels were 18 for most of my life. And I'm like, what the heck? And I'd take vitamin D and it wouldn't go anywhere. It would just stay there. So once I realized I had inherited a genetic variant in the vitamin D receptor, it made a lot of sense to me because number one, vitamin D didn't muscle test for me. And number two, it never worked for me. And so it made sense that my receptor doesn't work. You know, vitamin D can't get in there and attach. And so when I started working with the vitamin D receptor nutritionally and trying to figure out the nature of this receptor, how do I work with it? How do I make it work better? How do I absorb vitamin D? And then I figured it out. I found the key ingredients. Bam, turned on my vitamin D receptor, and suddenly my brain started making serotonin and dopamine. And those are our happy neurotransmitters. And I was happy, like for the first time ever. It was like, oh, that's what happy is. I had never felt it before. I'd heard about it. I thought I had felt it, but I really had never physically felt it. You know, it was like, my brain changed just like that. And I went, oh my gosh, this has got to be the answer. And it was one of those things where you get chills when you know you're on to like the missing piece or a big chunk of the missing piece.
Yeah, that's really amazing. I wanted to jump in and just add to what you're saying. There are so many people who have been living below baseline for all of their lives, or for so many years in their life, that they don't even know what it feels like to feel normal. And when we get people in for the first time and we have them, you know, in their first week of work with us, we have them filling out their symptom sheet, and we go through their symptom sheet and we explain to them that, you know, over the course of time that, you know, what we expect to see and what we want them to expect to see are improvements in their symptom sheet. And we might ask them like, okay, you know, for your depression, from a 0 to a 10, with 10 being the worst and 0 meaning, you know, no more symptom, where do you fall with the depression? And they'll say, oh, you know, I don't know, maybe a 6. And I'm like, okay. And then when you go back and you talk to them a year later, they say, I didn't even know how depressed I was because I didn't know what it felt like to feel happy. I was really like a 10. Like I had no idea how bad I was because I've been living like that since I was like 5 years old.
Right. Yeah. And you know, those kind of things, you know, that's so true because we don't know what we don't know. And I didn't know. And I'd beat myself up about it too. Like, why can't I just be happy? You know, what's the matter with me? I got a good life, you know? And so I would listen to positive tapes and do affirmations and do all the things that people do to get out of depression. And it just never did anything, never worked for me. But the other interesting thing was, you know, when I started researching the vitamin D receptor, I found a study that showed that people with that variant in their genetics have a higher risk of lung cancer when they smoke. So I went, okay, there's dad. And the other interesting thing is it's the vitamin D receptor is involved in activating your immune system to fight infections. And so bam, my lifelong, well, it was about 40 years of struggle with Epstein-Barr virus and chronic fatigue syndrome was gone. I got to bring this to the world. And that's when I started really diving in there and trying to understand how do we work with genes, you know, what cofactors do they need, what coenzymes do they need, and how do we how do we make up for the fact that you have a genetic variant like that? And put together a program. And so that's what I taught doctors all around the country. And I think you were in one of the classes there as well. And so because I had such tremendous results, and because my patients had tremendous results, and because the doctors that I worked with had tremendous results, I was like, I got to bring this to the world. And so that's when we created the MyHappyGenes program, which does all the work for you, calculates your genes, looks at what symptoms you're having, and then kind of spits out a diet, lifestyle, and nutrient program based on all of that information. So it's, it's like we're going after mainly like brain chemistry issues, depression, anxiety, ADD, addictions, which has been stunning what we're seeing with addictions, PTSD, those sort of things. So, and I know you're working in that realm as well, doing a brain chemistry, what you call it, a brain chemistry, mental health series.
Yeah, absolutely. Our 5-part mental health masterclass was my version of your Happy Genes book. It was, getting, and there's enough content in there to make a book, which we do plan on doing, sometime this year. But it was my way of, of being able to get that information out to the world, to let people know you're not broken. There are answers and there are solutions. And let me show you what it is that we have found that has not only helped me, but has helped, thousands of other, people around the world that are struggling just like you.
Yeah, very much so. And that seems like we're on the same focus there. And I just feel like there's this middle ground of people who you can't consider them really mentally ill. And they're struggling, but they feel like, well, I don't want to get on drugs. I don't want to do counseling per se. It never seems to work. And they're the ones I think that, they just struggle. They just feel like, okay, this is what I have to deal with in my life. This is the way it's going to be. And it doesn't have to be that way, because there's so much you can do to tweak your brain chemistry to turn it on and get it normalized. So that's pretty exciting.
That's, it's super exciting. And I will even challenge the diagnosis of mentally ill in any way, shape, or form or capacity. Because when a doctor gives a diagnosis to a client, and the client then believe, or the patient, whatever you want to call them, then they believe that diagnosis. They go home and read about that diagnosis and all of the things that come with that diagnosis. And what happens to them?
They wear it.
They wear it and they manifest it.
Yeah.
And, we understand that. And I know that you know this. Our bodies and our spirits are highly intelligent. And they can heal, and they do heal if you remove the barriers. Nobody is mentally ill. And who's to say that? Who came up with what's right and what's wrong and what's normal and what's not? If a person is acting in a certain way, shouldn't we be going, what's going on in their mind, their body, or their spirit that is not allowing their energy, their God-given light to flow through them so that they can express themselves fully in love and light and happiness and joy? If they can't do that, if they're struggling with that, what is it? Was it a heightened emotional experience? That maybe changed their ability to express their VDR-TAC gene, that vitamin D gene, where now they can't utilize their vitamin D, and then it causes a whole cascade of problems. Okay, well then let's deal with that heightened emotional experience. And maybe 30 years of counseling isn't going to work. I mean, if you have to go through 30 years of counseling, is it really working? And why are you still going? Why don't you try something different, like, an ayahuasca journey or an LSD therapy with a licensed practitioner who can, in one session can eliminate your PTSD that you've had for 20 years that's caused you to be a manic depressive or have schizophrenia or whatever it is, right? Like, we can get to the root causes. And, people like you and I, we just need to resonate our voices out there to the world and let people know they are not broken. They do not need to identify with their diagnosis, that there are answers and solutions.
Yeah, 100%. there are people that are at risk, of hurting themselves. And those are the people we don't want to be flagrant about, like, hey, just fuck up. But no, you're absolutely right. And, the interesting thing is, because I did emotional work on a lot of people over the years, and it had amazing results. And some people, it was just a bottomless pit of emotional issues. And once we get their brain chemistry fixed, though, then they have a baseline to work from, and we can get in there and get those main issues. So it's like there's this crossover going on between, is it truly an emotional cause, or was it a biochemical cause then that exacerbated the emotions? And when we look at an enzyme like the COMT that breaks down your stress hormones, if you're born with a genetic variant there, your stress level is up here all the time. So the minute you get, into a traumatic event, bam, you're escalated up to here.
Yeah.
If we can bring your physiology down to here and then clear that PTSD event, then bam, bam, it all falls into place. So
absolutely. 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 And it's just, it's just figuring out, like, looking at the person as a whole and figuring out what's taking priority here. What do we need to work on first? Do we need to put this person on like high dose methylfolate, maybe some sublingual methyl B12, some vitamin D with vitamin K? Let's get them going on that for the next 60 days and let's see how they do, and then changing their diet around. And then we can go in and start working on some of the heightened emotional experiences. Or do we need to kind of work on both at the same time? Do we need to integrate some breath therapy, some breath work to kind of help pull them, physiologically out of fight or flight while we bring in the nutritional side? It's just kind of like looking. And that's what's really cool about what you do with the kinesiology, where you're talking to the body, because you can like directly ask the body, okay, what is it that you want and need first, and then second, and then third. And, I absolutely love that. We don't incorporate a lot of kinesiology. Well, actually, I'll take that back. In a way, we kind of do with our brain repatterning therapist, Rosita. Mm-hmm. She will incorporate that type of kinesiology work. Actually, she'll actually do it, remotely. So she's not doing it, in person, but the cool thing is that you can do it remotely as well. So that's pretty cool. I know Anne had a story, or Anne had a question that she wanted to ask you.
Yeah, Dr. Dunn, let me ask you this. For the average person out there who doesn't have a history or a lot of knowledge about epigenetics and genetics, how does someone, one, discover what their genes are saying, and then how does somebody interpret that genetic blueprint?
That's a really good question, Anne. I used to use 23andMe and Ancestry, but I found their information to be problematic on several levels. One is it only gives us about half of the information that we are looking at as far as understanding underlying brain chemistry and health risks. So we wanted a program with a lot more data. Second problem with them is they do sell your information. So, it's a little bit of a privacy issue with them as well. And the third issue that we found with them was the spitting in the little tube was really difficult for some patients, especially small children and older adults. Mm-hmm. So we actually have created our own DNA test, and it's called MyHappyGenes. Here it is right here. And it's, you can go online to myhappygenes.com and buy that, but it tests, we have 376,000 SNPs that we test for. We only report on about 500 of those because we don't need all of that information, but about 500 of those genes give us a really good amount of information. And then we process it through our algorithm to give that information. So it'll show you, for those people who are sort of bootstrappers, like, I want to figure it out myself. I want to look at, what is this gene? What does it do? I want to do the research. I want to do the deep dive into understanding my biochemistry. It gives you that information and has links on it to studies showing, this gene codes for this enzyme that does this in the body. And here's the studies to show where that information came from. And it's, it's good studies. They're from PubMed. And National Institute of Health. And so we also calculate their risk of a particular issue. Let's say it's depression. So there are maybe 50 genes that are involved in depression. It isn't one gene, one issue. The VDR just happened to be like core for me, but it's only one gene. So we tally up all of those genes. Out of the 50, you may have inherited 10 of those that are what we call homozygous, which means like one gene from mom, one gene from dad. Both of those genes were the wrong code, which can impair, its function in the body. But so we give you an average risk. So for depression, let's say, mine was like way up in the 80%. I was like, wow, that explains a lot. My lifetime, kind of struggle with depression was definitely more than just the VDR, but there was a definite hereditary component there. It was so relieving to me. It gave me so much compassion for myself. But then we look at, ADD or anxiety or, your risk of those different categories. And then you can, like I say, you can deep dive into each of the individual genes and see how they work. And then we also do the same thing with diet, looking at, because how do you guys know what diet to put somebody on? It's tricky. I think keto is the latest fad. For some people, bad idea. Their gallbladder function is like, and they can't handle the fats that a keto diet would put them on. So this program also tallies that. So it looks at, how good would you do on a high fat or low fat diet? Which one is better for you? High protein, low protein, high carb, low carb, which is really important information. And then, like your sulfur, do you do well on sulfur, histamine foods, certain amino acids or salt or intermittent fasting, or, we tally up all those genes that kind of will influence your ability to handle those particular diets. So it's really handy for practitioners because now you can know, like, okay, for you, this is your best diet. Stay on, 20% carbs and 40% fats and 40% proteins, or whatever their best ratio is. And it was instructive for me because I was like high protein, low carb for most of my life. And I thought that's going to be my lifetime diet. Because I read a book. I read a book about it. And then I got my genetic test back and it turns out, no, not your best diet. Yours is complex carbohydrates are my best, and lower fat and lower protein. And it was like, since I shifted that, I feel a whole lot better. And so that was really relieving to me and relieving to a lot of practitioners who can get a real good genetic sense of what's best for their patients. Did I get off track, Anne? I answered your question.
No. I mean, this is great information. This is right along the same lines of the stuff that we teach, all of our viewers and all of our clients. And it's great to hear that from you as well, because there is no one size fits all. We'll have some people that will come to us on the first visit and they're kind of like testing us, like they're interviewing us. And one of the questions that they'll ask is, well, what diet do you promote? And we're like, well, we don't promote any one diet because everyone's different. You may need more carbohydrates and she may need more fat. And we can look at your genes because the data doesn't lie. Like the genes will tell you exactly how you need to eat. So that's like so spot on.
Yeah, it's very helpful for sure.
I heard you mentioned something there. You mentioned compassion. Talk a little bit about what genetic compassion is, because that's something that you mentioned. Tell me what does that mean to you?
Well, that's a really good question. And it's something that's near and dear to my heart, partly because, again, I kind of was beating myself up about being depressed my entire life. And then realizing it was like, that was biochemical. It wasn't my fault. And then I look at my father, who was like a really grouchy guy. And, we carry those things around. Like my dad was mean to me. But I looked at my genes, I look at my brother's genes, I look at my mom's genes, and I can extrapolate. He had this warrior gene that made him like too much serotonin that makes you anxious and irritable. And it's like, it gave me a lot of compassion. I went, oh, you know what? It wasn't personal. It wasn't him just being mean to me. It was just his physiology. And then another incident that happened in my practice that really kind of opened my eyes and made me think about diet and lifestyle in a whole different way. This woman came down from New York to New Mexico and on a regular basis. And she was so big that she had to buy 2 seats whenever she'd travel. And, what do you do with somebody who's obese? You go, okay, you're eating too much, right? Stop eating, stop the sugar, stop the things that we know, about health. And she'd say, no, I'm eating well, and a lot of patients would tell me, yeah, I'm eating well. Well, this went on for a while. And then when I switched over to doing methylation programs on patients, I put her on her first methylation program. She called me up like a week later and she was crying. And she said, oh my God. She said, I have to confess, I was eating like a whole bag of Oreos before bed almost every night, like a whole bag. I said, well, it was pretty clear that there was calories going in. She said, you know what? I don't want them. Like the craving completely stopped. She said, I realized it wasn't my fault, it wasn't about my willpower. It was about my physiology. And I went, whoa, it hit me like a ton of bricks, because we judge people, we go, well, just put the Oreos down, but, have a little willpower, just have a little strength here. Well, I started looking at these things in a very different way. I look at sugar cravings as a symptom, not a cause, and not a lack of willpower. That tells me something. So tell me honestly, what are you eating and what are you craving? And that don't feel guilty about it, because it's telling me something about your physiology. And so that gives people a lot of compassion for themselves and understanding that there's a reason that they're craving sugar. It's because they can't make fuel out of their food. They can't generate ATP. So their body's craving sugar. It's got to, your brain needs that fast sugar. So you got to get it. Your brain is very powerful. It's like, nope, we're going to 7-Eleven right now. We're going to get a quart of Ben and Jerry's. That's what's happening.
I really resonate when you say that about the clients, because I often, when I'm talking with food about clients, we will have that same exact conversation, and taking that blame out of the picture, whether it's you subconsciously blaming the client or the client blaming themselves. And that's what it usually is, the client blaming themselves. When you can take that blame out of the picture, you will see a client's compassion for themselves change, their desire to make lifestyle changes change. You'll see their motivation levels change when you can take that blame out of the picture. I think that's so huge. And that's something that we deal with our clients as well.
Yeah, it's so true. I tell people, you won't even want the sugar. Your body will go, doesn't even sound good. When we get your physiology right on, it'll just fade away. And that's been true too of drugs. When early on, when I was working with methylation with patients, somebody brought in their niece, and she's a meth addict, methamphetamines, and a young girl. She was in her 30s, and she had 2 young children at home, and she would abandon them for a week at a time. That's got to be a pretty strong, powerful drug to pull a mother away from 2 small children. She loves her kids. She didn't want this. This is not something she chose. But when we started working with her and changing her brain chemistry, she said within a week, the craving went away. And if you've ever dealt with meth addicts, you go, that's nice. And you wait, because often they're going to relapse very quickly. But she didn't. It went on for a year. She got her kids back. She got a job. She got her house, and got her life back. No cravings. And then she stopped her supplements, and then she ended up sliding back into the methamphetamine. Well, the family called me up and said, don't let her run out of her supplements, because this was working, and we will pay. So just keep them coming. But it's been 5 years now, 6 years actually. And I watch her on Instagram. She's on my feed, and they're all positive posts, and she's got her kids, and it was life-changing. And it was stunning to me, because I didn't know that was going to happen. I was like, I don't know, let's give this a try. But when we flood the brain with dopamine and serotonin and all the happy hormones, you'll lose your need to get that dopamine hit from drugs, gambling, alcohol, sex, workaholism, whatever it is that you're getting, wherever you're getting your dopamine hit. If you flood the brain with it, you lose that. And then willpower can take over. There's a little bit of willpower there. But at this point, you do some emotional work, because this person is like, I am not a good person. I'm not a good mother. I suck. They've destroyed their self-esteem in the process. And that, takes some rebuilding too, because they don't understand that it was a physiological imbalance, that, that the minute they try a drug like that, bam, they're hooked. So it's like opioid is another one. Mm-hmm. There are certain people that don't make the opioid receptors correctly. So the opioids have a more powerful effect on them. They stay in their system longer, and boom, they're addicted. and there are genetic variants there. So if you understand that, number one, you can know to avoid that. Like please don't ever give me an opioid derivative, because I've got the genes for that. In fact, I have those. When I was in the hospital one time, they gave me Demerol, and I was like, oh, I'm so happy. Can I have some more of that? No.
Yeah, there are so many people around the world struggling with their quote unquote labeling of their mental health disorders, so to speak, which we already talked about. I totally don't believe in those labels, but people are struggling, and they end up most of the time accidentally falling into something like opioids or meth addiction or alcohol, sex, all different types of coping mechanisms as alternate ways, but these issues have really become the whole stigma around mental health issues is something that we also are working to destigmatize. What is your take on helping society to erase these mental stigmas?
Yeah, it's a good question, Alina. I guess I should call you Dr. V. Is that what you go by?
You can call me Elena. It doesn't matter. Yeah.
It's a good question. I think it's a matter of education, because there's just so much, we like to put people in boxes and say, okay, you have depression, you have anxiety, you have, you're mentally ill or whatever it is. And like you say, they start researching that label and manifesting it and wearing that. So I think it comes down to, good education, that just these conversations like you and I are having, I think are super important for people to understand, again, number one, it's not their fault. And there's something you can do about it. There's a way to understand your brain chemistry and your physiology. And there are ways to work with it. It doesn't matter what you eat. It doesn't matter what you think, but it also matters what genetics, you inherited. And so I think it's just a matter of education and information. What do you think? Do you have thoughts on that?
That's spot on. We just have to educate people. Helping them to become aware is the first step to change. And, you're doing a fantastic job of bringing awareness, and we're doing the same thing. We should totally collaborate and see how we can do it on an even bigger scale together, because both of us have a big passion, and Anne too, for helping people that are struggling with these labels of these different mental health conditions. And we have found like 98% of them are fixable.
Yeah, I agree. I mean, some stuff that I never thought was fixable, including, I don't want to like say this is 100% doable, but one of my doctors had a patient who had a multiple personality disorder that, they say, yeah, that once you have that, you're done, and sorry. But she saw all of the personalities form into one for the first time in her life. And she wanted to go out and get a job. So that was unheard of. And it's like, wow. So I'm with you. I think very much so that majority of these issues can be explained. Number one, there's a reason for it. It isn't just your bad luck or didn't fall on you, or because you had a crappy dad or a crappy early life, you're doomed to health, because that's the story. It was the story I had. It's like, I'm depressed because, oh yeah, my dad was mean to me. That's it. But it wasn't true. It just wasn't true. Yeah, he was mean, but a lot of people have mean dads and they don't end up depressed for the rest of their lives, or two people can go through the same experience. One of them has PTSD and the other one doesn't. That we have to look at the underlying things. It isn't linear like we think it is. And again, we make up those stories in our head. Oh yeah.
Yeah, it's a multifactorial approach that you have to take. There's there are so many things that we have to look at that can all contribute, to someone's brain chemistry not working optimally, or, so many things that can contribute then to how a person is, creating patterns or stories in their mind that become these vast highways, that they get stuck in these highways of the story that they created that was, could have been secondary to the imbalance in their brain chemistry that could have come from.
Uh-oh, she froze.
She'll come back in a second. That happens sometimes.
We may never know where they came
Let's
from.
give her a second.
Are you in a different place? Are you at home?
Yeah, we're in different places. She's in Austin. I'm a bit further south. And, I to tie into what you were saying, I think a big part of what we do is also giving people hope that there is an answer there, because so many people, like we talked about earlier, fall into the pattern of believing those labels, and they'll believe that label for the rest of their life. And so a big part of what we do is, like Dr. Elena says all the time, you're not broken, giving these people the hope to keep looking for an answer, reminding them that they are not broken. And the body's amazing. We see their body heal all the time. Dr. V, you cut out for a moment there, but you're back.
I'm back. Yeah. So yeah, I mean, I don't know where we were. I was just talking about us putting the pieces of the puzzle together, and that, it is a multifaceted approach, and it is complex to, perhaps, like, for our viewers, they may go, oh my God, there's a lot of pieces of the puzzle, but that's why the world has Dr. J Dunn, and that's why the world has Anne, and that's why the world has Dr. Tori Thompson, who's on our team, who's not here with us today, and that's why the world has me. We can put the pieces of the puzzle together. We understand that that we are a mind, body, spirit, and there are a multitude of factors that are involved, including our genetics. And by understanding how to look at all of the pieces of the puzzle and put them together, people can get their lives back.
Yeah, and I don't know. Your talk is TribeTalk, right?
Yes.
Yeah. I love that word, tribe, because I feel like, we as natural healthcare practitioners, we are a tribe, and we have so much heart for helping people and understanding just what you just said, which is like, it's multifactorial. There are not any other, the rest of the world is working on, okay, I'm an otolaryngologist. All I look at is ears and, I look at noses and ears, and you guys look at vaginas, and you guys look at, it's compartmentalized. And we know that is just fundamentally wrong, because everything is related to everything else, including your emotions are related to how your body works, and your body works a certain way and it affects your emotions. And, there's the structure in there, and, it's all, we got to look at all of it together. And that's the holistic approach, which I think is much more, it's just right on. It's just right on in trying to get to people's health issues, because it's never like, oh, it's not just coming from your kidneys. It's coming from your emotions that affect your kidneys, et cetera, et cetera. So I love our tribe. I think we're amazing. And, we're not about money. We're not about getting rich. We're about helping people and helping them, empower them. I'm really passionate about that. Having people understand that they can understand what's going on with their bodies. It's not as complicated as a lot of doctors might lead them to believe, and that they can understand it. We're coming up with a concept too called a PhD in me for patients. And maybe you're along the same lines there, educating patients about understanding their own bodies.
Oh, absolutely. And I would love to hear more about what you're doing. Our approach, when we start working with people, one of the first things we tell them is, look, yes, there are a lot of doctors on our team, but we are not going to have a doctor-patient relationship with you. You already have that with your other doctors. We are going to have a mentoring and instructor, student relationship with you. We're going to teach you how to understand your own body, how to understand all of the different facets or factors that could be adding to or causing your issues. And we're going to teach you protocols that you can use, and why you use these different botanicals or herbals or nutraceuticals or whatever it is that you're going to use, and why you need to change your lifestyle. We're going to teach you and empower you so that you can get yourself better, and that you'll also, have an awareness of a lot of the things that made you sick in the first place, so that you can bring about change, so that you can help your children and your children's children. And, it's only through educating people and making sure that they understand how to heal themselves. People need to heal themselves. They need to take responsibility to heal themselves. And so we take that same approach that it sounds like what you're putting together. That's what we do. We actually have a brain body mastery restoration program, and it's a 12-month program that we put people through. And depending on what level that they're doing, it can include all of their labs over the course of a year, so that they can even retest. So for example, like if they're mycotoxins or their mold, toxins are showing really, really high. And we know that that can really cause some massive issues with the DBH enzyme. So now their dopamine converting enzyme isn't working, and their dopamine's getting high, and their epi and norepi are low. And then it's causing, these, autoimmune issues, and these gut issues, and these fatigue issues. And, now they're not making their ATP like they should, and all of that. We teach them all that. And then we put them on a schedule and teach them why we're going to retest that every 4 months over the course of a year, and show them what to expect on each subsequent test, what to take to pull those mycotoxins out of their body, what they should be doing to make sure they're not getting current re-exposure. And so everything that we do is teaching them so that they can take responsibility for their own health, and they can find their own way back to health and vitality.
That's awesome. I love that. Congratulations on that. So what is it? One weekend a month or something, or one day a month, or what?
No, we actually have weekly classes that they will attend. They don't, and not everybody needs to necessarily attend all the classes. The classes just go into what's already in the program, in the online program. And so they can go online, they'll go online and they'll just go through each module and they'll learn. And there's videos and everything. And then with the classes that we offer, we have our biological coaches that teach them about their labs and how to interpret their labs and all of that, and protocols and troubleshooting for Herxheimer reactions and all of that. And then we have our, Anne, who is our lead nutrition and lifestyle coach. So we have a couple of coaches in that arena, but Anne leads that whole division of that area. And then we have our mindset and repatterning coach. We have our yoga breath therapy coach to teach people how they can use body movement and breath to basically hit the right buttons to pull them out of fight or flight. And then we have our epigenetics coach who goes in and teaches them all of that. And so we teach them from all facets, and it's an online program, but we do have weekly classes that they can jump on if they have any questions or things like that.
That is so awesome. Congratulations. That's amazing.
Thank you. Thank you. Yeah. We should have you on as one of our guests one day. That would be a lot of fun. I'm sure everybody would be super excited.
I love that. Yeah, I love that.
Well, Dr. Dunn, it's been incredible hearing from you today, and just hearing your passion for helping people just like we do. And MyHappyGenes, how can people find out more about you? You have a website where people can go?
Yeah, if you just go to MyHappyGenes.com. If you go to MyHappyGenes.info, you can download a free ebook. They'll tell you more about it. And if people want to get their genes tested, we can give your group a discount if they're interested. And I'll put it under Tribe 25, and it'll give you $25 off the cost.
Absolutely.
That sounds great. Absolutely.
Yeah, I would love to come back and chat with you guys more. I love what you're doing. You're doing some amazing stuff over there. And I think there's some overlap and some things where we can help each other and make the world healthier and stronger and empowering. I love the concept that you guys are doing of empowering the patient, educating them. And that's so, so important.
Absolutely. That education is such a big factor. And we feel that that's what really helps.
That means that are
We're having some connection issues today. That's okay. It happens when you're on Zoom all the time. But yeah, we feel like it's that education aspect that really drives our clients to then have the know-how and the confidence to carry what they learn forward and have just that healthy lifestyle moving forward.
Oh, life-changing. Sounds amazing. Yeah. Awesome.
Thank you so much for joining us today.
Thank you so much, you guys.
Thank you. Thank you for being with us, and we'll connect, and we appreciate you offering that discount to our clients. We're going to pass that on to everybody. And for all of you listening and watching, thank you for being here with us today. Sorry for the connection issues, but happens when you're on Zoom all day. But again, thank you guys for listening, and we'll see you next week for more on Tribe Talk.
Okay. Bye. Thank you, guys.